This is how I learned to work, and this was very different than what I learned in school. When I went to school, you put them face down. I was like doing work on the gluteals and then doing work like stripping out the lumbar, paraspinals. And again, that routine I learned in school wasn't helping their low back pain. They're like, it's not really, and I'm like, now what? Because I was kind of at a loss, at least initially. Like I had to kind of figure out, what I was doing. What I learned from Thai massage really changed the nature of what I was doing. And I'm gonna get her to let her hip go. There we go. I'm gonna hook her in my holster here. Now, the reason I did that, I have, in my experience, I have 20 years in chronic pain management. Just give me 5 minutes. Once I do this and she feels it in her low back, she's like, oh. Because you don't want it to be that situation where she says she has upper back and neck pain and I work on her feet. That's what she doesn't want. She wants me to work on the thing that she came in for. So when I bring you in right here, how's this? Okay, is that too much pressure in the adductors right there? And then does it feel better when I'm closer to the knee or when I'm like just closer up towards the hip?
I think closer to the hip.
Closer to the hip. And when I lean in on the hip there, does that make it just a little bit deeper? It feels good?
Much deeper.
Does the rocking in and out help right there?
Mm-hmm.
There we go. What happens if I bring you over to about right there?
It's a good stretch.
Okay, cool. Mainly just hip mobility, a lot of gluteals, particularly piriformis from this position right here. Does it feel better on your low back when I bring you all the way over?
I feel a little pain right there.
A little pain?
Mm-hmm.
Is that where you want to go?
To the pain?
Yeah.
I want the pain to go away.
Okay.
But yeah.
So in other words,
it's not unbearable when you do
of the range that I brought you through, is this the place that you like the most?
Yes.
There we go. Because all I'm doing is mobilizing the femur and getting a range of motion through the hip. Like, I prefer that they communicate with me verbally because I don't have to guess as to whether I'm in the right spot. They told me. They're like, right there. When I came in and went right to the spot that was bothering them, that's like a benefit to me. A little bit of hamstring stretch feels good as well. And then when I lean in, you like that?
Yes.
There we go. And would you prefer me almost like hold that?
In that spot?
Yeah.
Yeah.
Okay.
Yeah.
And this was just to reverse my body mechanics for a minute because she seemed to like this. When I bring your leg back down, does that feel like better on your low back?
It does.
So when I bring you in right here, that's it?
Yes.
Is it too much pressure? There we go. So let me bring her through a range of motion again. And we kind of knee to opposite shoulder is kind of like piriformis, gluteals. The hamstring stretch from the shot put here, straightening the leg a little bit. And then if I bring you over, what happens if I isolate just a little bit of the shoulder? Is that too much?
No,
Feels good?
it does.
There we go. And this was just to change the angle of attack, if you want to call it that. So instead of having just the push, what happens if I take your leg here? I'm going to see if I can isolate almost around the quad. How's the pull right there?
No, that feels good.
It feels good? Now, if I bring you back to neutral, how does your low back feel?
Feels good.
Feels good. So you're having low back pain before, right? That's right. They always want hands-on instruction, and I will never stop teaching hands-on.